Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're going to be going over a small but important topic, which is one that can become very frustrating for breast cancer survivors, and that is how to treat painful sensitive portacath scars. I know a lot of my patients will report sensitivity, tension and pain around their portacath scar. So I'd just like to start by saying that this video is about the treatment of portacath scars. It is not when the portacath is still in. So just be aware that this information is only relevant to people who have had their portacath removed. So for those who aren't aware, a portacath is a device that's put into a central vein so that chemotherapy and other blood draws and whatnot can be performed, particularly while someone is going through chemotherapy. It's quite a viable device to be used rather than having a cannula put into the arm. So it also helps with reducing risk of venous collapse in an arm if people's venous supply isn't fantastic. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below if you have any questions around how to reduce pain or sensitivity for portacath scars. Now I have already done a few other videos when it comes to reducing sensitivity of scars, so I'll just leave a link to one of those videos in the corner up here now if you want to go and check that out. But today's video is concentrating on portacath scars, and the reason this has come up is because I've had a couple of patients of late talk about how sensitive and painful their portacath site is, and it's not often something that's addressed because it's such a small little scar, but it can cause a lot of problems. So the common reasons people will find this scar is annoying them is if they lie on that side at night, if there's any clothing rubbing over that scar, or if they use that shoulder that the scar is on the side of. So if you're stretching out to get something, you might find you get a little bit of a pulling and pain through the scar site. There's probably other reasons why portacath scars can get annoyed, but at the end of the day, it all comes back to two things: desensitizing the scar and then getting the flexibility of the scar tissue more mobile. So the good news is that this is a problem that can be resolved. It's not necessarily an easy thing to do, particularly if it is a very sensitive site for you. But the take-home message is that if you apply the right treatment techniques, then you should find a good improvement in your portacath scar. So the first thing I want to talk about is the fact that if you've got a sensitive and painful and tight portacath scar, the first thing we have to get sorted out is the sensitivity issue. Because if you've got a painful, tight portacath scar, or any scar for that matter, you can't address the tension in the tissue before you address the sensitivity, because to get rid of tension in scar tissue, you need to apply quite firm pressure. Well, that's certainly what I found through my clinical experience over the last 7 or so years. So if you have to apply firm pressure to a sensitive scar, you often are not going to tolerate it. So it's much better to first address the sensitivity of scar tissue before addressing the tension and the pain issue. So how do we desensitize scar tissue? It does come down to the individual's level of tolerance. So when you first start to apply some mechanical pressure to a very sensitive scar, just start in really short stints. It doesn't matter if you start for 10 seconds, 20 seconds, 30 seconds. Just keep your pressure light and keep it to what you can tolerate, because if you go in too hard and fast, you'll find that you will end up in quite a lot of pain and you won't necessarily be really motivated to go back and do that again. There's a lot of people that I meet who will say to me, "Oh, I just don't touch that scar because it's too painful." The news I can give you is that if you never touch a sensitive scar, it will remain sensitive forever. There's scars on people that have been there for 30 or 40 years that will be forever sensitive because they've never done the work to apply any sort of pressure. So you're not going to get a sensitive scar better by ignoring it, essentially. So when you first start touching it, make sure it's to tolerance levels, make sure it's short and sweet stints, and also make sure that as you're finding any sort of improvement, that you're just gradually increasing the time and the pressure that you apply to the scar. When you're trying to desensitize a scar, you don't even necessarily need any sort of lubricant or moisturizer to go on that scar, because just the touching of the scar is going to help the desensitization. On that note though, if it makes you feel more comfortable to have a little bit of moisturiser on your hands to rub over the top of the scar, that's fine as well. It's really whatever works, and just make sure you stack the cards in your favour when you're trying to solve this problem, because it's not an easy thing to deliberately go and touch a body part that is uncomfortable and very sensitive. So shower time is a really good time hack to do scar tissue work, whether it's desensitization of the scar or improving the flexibility of the scar, because you're in a warm, safe place and you've already got your clothes off, so it's a good area to get into scar work. So the second thing you're going to concentrate on once you've reduced sensitivity of a scar is then improving the flexibility of that tissue. Now, interestingly, the other day, one of my patients said to me, my Portacath scar is quite painful, but when I actually felt her scar, there was no tension in it whatsoever. It was just sensitive, not tight. So sometimes people only need to work on sensitivity and then all of that pain will disappear. But then you can also have a situation where you can touch a scar and it may be sensitive, but it might also be quite thickened and tight. And that's where once the sensitivity is gone out of the tissue, then you can start to get the tension also improving. Now, a Portacath scar is quite a small site, so it's not like you have to do any firm massage for hours on end. Literally for 2 to 3 minutes a day at most, maybe 1 to 2 if you're really time poor, I would suggest that you get into firm massage or massage as firm as you can tolerate, and just do that for a couple of minutes a day to reduce the tension in the scar. Now, if you're doing that, you should have the expectation that you'll see some sort of reasonable improvement within a couple of weeks. Hopefully this is not a job that will be continuing on forever, because once you've improved the flexibility of the tissue, most of the pain and the tension goes away. Another little trick for Portacath scars is that where the Portacath scar is located is often in the region of the pectoralis muscle. So there's a really good stretch that you can do through this region of tissue, and it's best performed in a doorway or up against a wall, where you can put the palm of your hand on the wall and then straighten out your arm and then rotate your body away. I would usually get patients to hold this stretch for around 20 to 30 seconds, but if you're particularly tight, then you'll probably only tolerate this stretch for less. Make sure that when you're doing this stretch that you're winding up that rotation through your trunk quite slowly. If you whip around and do that rotation really quickly, then you're probably going to find you get a big pull through your pectoralis muscle. This muscle is often tight anyway, regardless of whether there's a Portacath scar there or not, because during breast cancer, a lot of tension can build up around the shoulder girdle and the pectoralis muscle will often become tight anyway. If you've been applying some desensitizing work to your scar, or if you've been applying some soft tissue massage to the scar to improve its flexibility and therefore reduce pain and tension, but you're really not seeing any sort of improvement within a couple of weeks, then I would consider going to a physical therapist or a physiotherapist or an occupational therapist, but ideally someone who has experience with treating patients who have gone through breast cancer. Because generally there's going to be a reason as to why that scar tissue is not improving. I can genuinely say that the large majority of my patients who do a little bit of work themselves on their scars in the right way, or people that I'm working on who have got scar tissue pain and tension who are coming to see me, they are generally getting better steadily. So if you're not improving with this work, then please go and see a medical professional or an allied health professional, because there should be a reason as to why that's not happening. The other thing to consider is that if you've applied a fair bit of work to a Portacath scar and it's not improving, there may be other structures around the shoulder that are also restricting that area from improving its flexibility. So consider that you may need to have a physical therapist or physiotherapist look at other regions around the shoulder to improve the Portacath scar. I'd just like to add a final note here too, that if there's any scar tissue following your breast cancer experience that is particularly sensitive and painful or tight, and there's very limited ability for you to do any work on that scar yourself, or even your physical therapist or physiotherapist or occupational therapist to be able to perform any work, this is where medication can play a very important role. Now, I can't prescribe medication because I'm only an allied health professional, but this is obviously where you can get your general practitioner or your other medical specialists from your breast cancer team involved to help. Now, I know a lot of breast cancer patients are very against the idea of taking any more medication, and I can completely appreciate that position. But when you've got a problem like scar tissue pain or scar tissue sensitivity to solve, sometimes a short stint of medication to dampen the level of pain and sensitivity so that the physical therapist or physiotherapist can actually get in there and do some work, and you can get in there and do some work, that's going to be a really good means to an end. And like I've said in other videos recently, persistence pays off. So sometimes some of these side effects are not quick to treat, but if you persist with them, most of the time you're going to get them a lot better, if not completely resolved. Thank you so much for watching this video, guys. I hope you've gained some really great information. I hope you're having a wonderful week wherever you are. I'll be back with another video next week. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.